Hello there, my name is Jiaxian from Biomedical Science Cohort BN122, and today I'll be reviewing the book ERS Handbook for Respiratory Medicine, available on ProQuest eBook Central. So I and you actually subscribe to this book, and we have unlimited access to it. And you can view this book from the website, and you can also download the book or download the PDF chapter because it's a very thick book, I have to say. So this book is written, I think, from European Respiratory Society. That's why it's called ERS Handbook, and it goes very in depth about respiratory medicine. So you see here from the contents, first they start off with anatomy, right? Chapter 1 is anatomy and the cytology, immunology and defense. So mostly anatomy stuff, and then the gas transfer, the theories, and then starting from chapter 8, Archer-Berg gas assessment. So this is more about diagnostics tools that can be used for respiratory illnesses. And after that, it's mostly about issues with respiratory. So dyspnea, chest pain, cough and sputum, physical examinations, and then you got CT scans, biopsies, and then a little bit further, you can see smoking-related diseases, tobacco dependence, and then got lung transplantations, asthma, bronchitis, COPD, and even the infections, upper respiratory tract infections, pneumonia, hospital-acquired pneumonia, and then lung cancer, chemotherapy, um, acute respiratory failure, fibrosis, amyloidosis, hypertension, pulmonary hypertension, embolisms, chest wall disorders, HIV-related cardiac diseases, occupational diseases. I think it covers a bit additional COPD. And so high altitude and diamond-related diseases. So there's 117 chapters, roughly talking about the anatomy, the pathophysiology, different diseases, different diagnostic tools, and also treatments. You see, just now we have like transplantation as a form of treatment. So I said this book is very in depth, right? Covers from the head to toe, anatomy, pathophysiology, and down to treatment and diagnostic tools. And let's go to one chapter and see. Let's go to cytology of the lungs for anatomy. So while we wait, I would say this book is very good for revisions and learning about pathophysiology, the anatomy, in this case the cytology for this chapter. So what I like about the layout is that first we have a brief introduction, very brief introduction with some notes. So they talk about the routine staining procedures, right? So this is good for biomedical scientists and also medicine students if they want to become pulmonologists or pathologists, and they have key points, right? Tables, more tables. You see, it's very in-depth and very structured. It's very good to learn about the diagnostic tools in this particular topic. They have smear, cytospin, tip preparation, and tin. Okay, no tip preparation, but tin preparations, flow cytometry, and other expressions like the EGFR, VAF, MAT, PDL1 expression, and T cell receptor monoclonal rearrangement. So those are very good for biomedical scientists as well as pathologists so that they know what kind of test they can do for lung samples. Of course, you can't miss out the pictures, right? You got the figure 1, sample showing multinucleated cells, more cells, so bowel samples showing macrophage containing large empty vehicles, the large empty vehicles. And they will tell you that this is also a lipid pneumonia. They will tell you the preparation they did. So this quick preparation is used for this sample. Let's go to another topic. Oh, PD1L, PDL1. Let's go to another topic. So you can access the topic from the side panel here. You can also star it, annotate. You can bookmark it. So I like this topic. I like this chapter. I can bookmark the chapter, and it will show out in my annotations, and I can come back to it later. Even goes to the page. So if I really like the page, this can highlighted page 16. I can come back to it later. I can also search. Let's say I'm looking for a particular word. Let's say like PDL1. Right. The 23 results for PDL1, and I can find it very easily. Let's go to diagnostic topic like actual blood gas assessment. Let's see how is it like. Again, you have your brief introduction, key points, interpretations, and steps to evaluations of lung gas exchange. Very in depth. We give you the chart. So how do you differentiate when you get a blood gas assessment? How do you know if this is alkalosis or metabolic alkalosis or other? I think there's other as well, but yeah, it's very helpful. And here's explanation for respiratory acidosis, alkalosis, and metabolic acidosis, alkalosis, and the difference. So this is your pH, your partial pressure for carbon dioxide in your blood, and then your carbonate. So there are other symptoms of the diseases during respiratory alkalosis and acidosis, and also for metabolic counterparts, and beautiful figures for you to understand better. So let's look at CT scan. So if you're interested in radiography, of course you have your figures as well, CT scans, images, and explanations and how to interpret them, right? And of course, can't forget the further reading if you want to learn more about it. Let's see, COPD. So let's look at the chapter about diseases. So I give you a brief summary about COPD, the pathophysiology and etiology of COPD, and the key points. I've got diagnosis and assessments, your tables to understand better, symptoms, development, management, how to manage COPD, pharmacotherapy, what kind of drugs can be used to treat COPD, non-pharmaceutical intervention, treatments, prognosis, and further reading. So I would say overall this book is very in-depth. It covers from head to toe the anatomy to pathophysiology, diagnostic tools, and treatment. And I think it's good for medical and biomedical science students. I think it's still a bit in-depth for biomedical science students, but it's always good. If you want to learn more, you can always refer to the book, or you have any questions when you're studying, you can refer to the book and you'll probably find an answer here. And I think I can also give it to pharmacy students if they want to learn more about the treatments for specific diseases, in this case respiratory diseases, and maybe Chinese medicine and chiropractic for the first few chapters. Because textbooks usually are very detailed and you can cover a lot of things and a lot of courses can relate to it. So I would recommend this book, especially to my medicine and my medicine friends. And yeah, I think that's all from me about the ERS Handbook, Respiratory Medicines, and have a good day.